Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello, I'm Tom Lavin. Welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you've had a chronic illness or someone that you love has had a chronic illness, you might want to watch our show today as our guest, Dr. Stephen Hayes, is going to be talking about how to deal with the pain and the suffering of having a chronic illness. Our guest, Dr. Stephen Hayes, is a professor in the Department of Psychology at the University of Nevada, Reno. He is the author of this really wonderful and very helpful book, Get Out of Your Mind and Into Your Life. Dr. Hayes, thank you so much for being here.
It's great to be here.
All right. So we're going to be talking about chronic illness today, of course, and chronic illness really deeply affects the lives of people with cardiology problems, chronic pain, all kinds of difficulties in their life. How has ACT research shown that the therapy that you practice, ACT, can be helpful to people?
Well, the challenge that people face from the chronic illness is sort of two kinds. You have to face the physical challenges that are there in dealing with things like diabetes, heart disease, pain, and so forth, but there's also the psychological challenge. And often people get very little training in how to do that. Mm-hmm. And some of the things that you're naturally prone to do when you're faced with the challenge of a chronic illness turns out not to be helpful, can even be hurtful. So we try to move some of the things that aren't helpful out of the way, get people focused on things that really work, empower people to step up to the challenge of chronic illness.
What are the things that you've seen? What do people do that when they have a chronic illness and in general it doesn't work?
Some of the worst things you can do are to deny and avoid the problem, to try to push away difficult thoughts and feelings, to talk yourself out of it. Part of what's difficult about that is every time you do healthy things that actually manage an illness, you're going to be reminded of it. And so what tends to happen if you're very avoidant and trying to manipulate your own insides as a way of dealing with the illness is you tend to try to not attend to it. And many of these problems require attention. You have to figure out a way to be able to attend to it in a way that doesn't entangle you, that doesn't knock you off center. And that's exactly what's inside the ACT message.
So people, we might tend, if we have a chronic illness, we want it to go away, and we're kind of like an ostrich, and we put our head in the sand and we hope that if I don't take my medication, if I don't make my doctor's appointment, if I don't talk to my family about these symptoms that I'm having, maybe it'll all go away.
Exactly. You want to pick a good example, take diabetes. Every time you stick yourself and look at those numbers, you have the possibility of getting some bad news. Even if you get good news, you're reminded that you have a chronic disease that is going to threaten your health for your entire life. It can be managed, but it's very tempting to just avoid dealing with the details of your diet, exercise, monitoring, taking your medications, and then you begin to pay the cost in other ways so that you're headed down a kind of self-amplifying process of the disease getting on top of you rather than you on top of the disease.
And have you found, like, so on one hand you were saying we can tend to avoid this, have you found that on the other hand someone might get into like hyper-control and just really overly focus on their illness and maybe like become their illness? Can you talk a little bit about that?
Absolutely. You begin to become so focused that and really what's usually inside that is another form of avoidance, such as avoiding the fears around mortality or morbidity. And when you're dealing with a chronic illness, you need to be realistic with yourself and sort of put it in its proper place in your life so that relationships, recreation, work, all have a proper balance, and that your life doesn't become about the illness, but rather illness is an aspect of it that you're managing in a healthy way.
Okay. So that if someone has diabetes or heart disease or chronic pain, some other chronic illness, your therapy, the way that you help people approach dealing with their chronic illness helps them to not get into avoidance or not get into the other type of avoidance, over control. Right. Can you tell us about that, please?
Essentially what we do is we teach people to be more accepting of their emotions, more mindful of their thoughts, taking their thoughts from up close to having a little bit of distance on them and just noticing that they're there. Come into the present moment, focus on your values, and get your feet moving. And so that the values that are important generally are not really about the illness, they're about the people in your life or the work that you want to do. And so that gives you the balance. But the acceptance and mindfulness keeps you from the avoidant processes that also are unhelpful. So that combination of acceptance and mindfulness on the one hand and values-based action on the other is the formula that we teach people how to apply.
Well, that's certainly something that we want to take a look at in the next segment, this idea of accepting our illness, accepting our feelings, feeling our feelings, and then those other steps that Dr. Hayes mentioned. We're going to talk about that right after this brief break. Hello, and welcome back to New Skills for Living. We're talking with Dr. Stephen Hayes from the University of Nevada Department of Psychology. And he was talking with us about how if we have a chronic illness, we can tend to want to avoid it. And what ACT therapy will do is to help people really deal with the pain and the suffering by not avoiding it, by moving into it. And Dr. Hayes, you were talking about accepting and then being mindful, focusing on values, and then moving our feet. Can you kind of walk us through each of those steps as you might with a patient who's coming to see you?
Well, sure. The acceptance piece, people often are not very aware of what it is that they're feeling, and they tend to sort of say, oh, I can't stand it, or things like that are very global. Often they're not emotions at all. They're more like judgments and evaluations. We teach people to watch what their body is doing, to watch what they're reminded of, what their emotions are, and then to hold them gently. Because these are difficult processes. It's normal to be upset, to have frightening feelings, difficult feelings. We teach people to sort of learn to watch their thoughts the way you might when you're meditating, and to stop struggling with them and stop pushing them away, and to pick and choose which of those are most useful to you in guiding your action without having to argue back and constantly inside a little war inside your head. And then finally we focus on, well, what do you really want your life to be about? You're here, you're alive, yes, you have an illness. We're all going out horizontal. So you do have to face issues of mortality. This is built into it. But while we're alive, what do you want to be about? And what would we have to do in the world of behavior to make your life be about that? So it's a matter of sort of releasing yourself from a struggle and then focusing on what it is that you can do with your moment-by-moment interaction with the people around you, with your work, with the things that you care about.
So that if someone has just been given a diagnosis of type 2 diabetes and they're going, oh my gosh, what does this mean? It means all of a sudden they become aware, I'm going to die. Eventually, I have a body that's not working. So they're full of anxiety. How am I going to tell my wife and the kids?
And people can put themselves in a psychological state in which even the information that they need to know is no longer helpful. We've done research in which we've shown that if we use the American Diabetes Association educational packets, sometimes people are so frightened that even when they hear the information, they're unable to use it. They can tell you what they're supposed to do, but it's too difficult. And so we try to create a more receptive ground. It's like tilling the soil so you can plant a seed in which some information that may be frightening, but it's also empowering. How do you monitor your blood glucose? What do you have to do with diet and exercise? And yes, what are you going to do with your family, and what are and the questions that are going to be asked of you, and so forth. Some of those are going to be difficult. Some of those are going to be painful. But if you learn how to hold that in a gentle way, you can walk through that and still have a vital, long life.
So it actually could actually lead to greater richness in a person's life, actually, couldn't it?
Exactly. And people who do go through this process often will say that they've learned a lot from doing it. We have a book on ACT for diabetes that's coming out probably around September. And so people who are dealing with that specific one, but there's ones for other illnesses as well, might look to how to go through that process. If you do it well, it can be a real lesson. Challenges, I think, can deepen us, enrich our lives, and not just be a weight or some oppressive thing.
So you were talking about focusing on values and then moving your feet. So it's like someone says, oh my gosh, I'm just getting out of the hospital now. I've had a heart attack. I'm walking out of the hospital. I'm going back home. But rather than hiding under the covers, I've got kids, or I've got a spouse, or I've got a meaningful job. So we focus on values and we get moving. We don't allow the illness to overtake our life or to paralyze us.
That's right. And if you think about it, let's take the diabetes example. There's a difference between simply trying to avoid loss of limbs or blindness on the one hand, or being there for your grandchildren on the other. One is very much richer, more human, more passionate. And if people can connect to what they want to do with their life and really have this process of disease management be about that, then it lightens the burden. It dignifies the difficulties. That it's not an end in and of itself, but this is a means to being able to empower your life and do the things you want to do.
Yeah, so when you're talking about empowerment, I mean, I can imagine someone who's just received the information from their doctor that they have this chronic illness and that there are things they're going to need to do. And in fact, they might be even more committed then to being a loving husband or a loving wife or a loving father or making a difference in the world, whereas before they might have taken it for granted.
Exactly, and you hear those stories many times of people who faced loss, challenges, physical challenges, people who died close to them, saying that.
Yeah.
On the other hand, other people are really crushed by it. So how do you go from one column to the other?
Yeah.
And it turns out, we know from the research that it's some of these acceptance, mindfulness, and values-based processes will help keep you in the right column.
Okay. So the therapy that Dr. Hayes is talking about, again, is explained in this book, Get Out of Your Mind and Into Your Life, and other ACT books. We'll talk more about this with Dr. Hayes after this brief break. Hello and welcome back to New Skills for Living. We're talking with Dr. Stephen Hayes from the University of Nevada. Dr. Hayes, we were discussing how the Robert Wood Johnson Foundation has donated, I believe, $500 million to address childhood obesity in the next 5 years. Of course, that affects individuals and families, but actually our whole society. It's really a social problem. Can you discuss this at length for us, please?
The chronic physical illnesses that we're seeing, many of them are related to our health practices, and obesity is one, lack of exercise is another, and it's now going deeper and deeper down the age range, so that we're beginning to see more and more childhood diabetes linked to childhood obesity. It really is a national epidemic, and it reflects something that's going on in the culture. We're getting less training as to how to step up to difficult challenges, and some of the social support processes that used to be there are going down, and when they are there, they're supporting bad practices. So that we find, like with the children, that often what's going on with children who are running into health problems related to exercise and obesity, it's because the parents are having a difficult time not placating their children with sweets and so forth, and going through the more difficult thing of teaching healthy behaviors for their kids. So it's almost an intergenerational problem. When we don't know how to step up to difficulties ourselves, we pass that same problem down to our children.
So are you saying that it's almost like a character issue? When you say step up to problems?
It's a cultural practice issue. What's going on here is that we are playing with two sides. We're playing with indulgence and suppression. And what we're not teaching is this sort of more open, accepting, but very active and values-focused form of dealing with your life. It used to be in our spiritual and religious traditions, and it's still there to a degree, but those have weakened a lot, and they've changed. And so people aren't regularly faced with small challenges. Young children used to be asked to do things like not eat certain foods, fast at certain times. That's much, much less now. You can go through the developmental period and really basically never be asked to sit with even minor distress, with television shows that chop for like 15 and 20-second bites, always keeping people entertained. You never can be bored. The end result of that is people don't know how to step up to difficult challenges. And I think the difficulty that we have with dealing with chronic disease reflects some of those cultural practices, that this is a larger problem that is evident there every time we step on the scale in the morning, that we're having a hard time learning how to say no when it's hard.
So, Steve, if a family comes in to talk with you, the husband and wife and two kids who are obese,
yes,
and what would an ACT therapist do then in the midst of this social milieu, this problem? How would an ACT therapist proceed?
Well, if you look at the dual devils of indulgence and suppression, the indulgence side would be obvious enough, if it's always about potato chips and cookies and watching television and not exercising. But the suppression side, we found in our research, for example, with weight and the studies we've done here, that a very incriminating and critical style also predicts weight problems. So you would think that if you just were harsh enough on yourself, then you'd straighten up. Not true. What you need to do is to be gentle and kind, but also disciplined. And it's the same thing with our children, as we need to be gentle and kind, but disciplined. And so that, teaching them, the discipline to exercise regularly. And yes, you may have to walk to school. An astounding percentage of kids are driven to school even if the school is a few blocks away. And it's not just safety issues there. Some of it is that the kids are just not used to any kind of physical exercise. And I think it just reflects a larger problem that we're all swimming inside this stream of indulgence and suppression, and it's not healthy. We have to learn a better way.
So as I'm hearing you talk about this, of course, the ACT therapist would be talking with the children about making some changes in terms of suppression or indulgence, but it sure sounds like the parents are going to need to change too, huh?
They are, and the kids aren't going to be happy initially when you make the change. And they're going to have to sit with some discomfort there. But still, you're not going to be able to eat that, or you can only have a certain amount of that. You have to eat this, and yes, we're going to go out for a walk, after a dinner, and that combination. If you create a family culture that is accepting but yet disciplined, it will help the children learn the kind of healthy lifestyles that they'll need when they face these kinds of challenges of illness in their life.
Yeah. Well, that is some really important information to hear from Dr. Hayes, and we're going to pursue this in our last segment today, right after this brief break. Hello, we're talking with Dr. Stephen Hayes, the author of Get Out of Your Mind and Into Your Life, and we're talking about how to gracefully and courageously deal with chronic illness. And we've been talking about dealing with physical illness like heart disease and diabetes, but now we want to turn and focus on depression and anxiety and other mental health issues. Can you talk with us, Dr. Hayes, about how ACT can be helpful for people suffering with those chronic illnesses?
Well, the ACT research is sort of amazingly broad. The same basic formula seems to work in many areas, but there's one thing that is different, which is in some of the physical illnesses, like diabetes, it's likely that you're going to be dealing with that for the rest of your life. Anxiety and depression, it turns out that some of these methods will actually prevent the development of further recurrences of anxiety and depression, and will help shorten the episodes. So it's not just a matter of managing, it's also a matter of releasing and moving on from of a depressive or anxiety-focused way of being in the world. But the same basic message is there, and it turns out that it's curative and prophylactic. It actually helps release us from these processes and will prevent their reoccurrence, to bring acceptance, mindfulness, and values-based action to them.
Could you kind of give us an example maybe of someone that might have depression or someone that might have anxiety, and how you might work with them in walking through those steps?
Well, let's take depression, for example. There's a tendency for people very often to socially withdraw, or to no longer engage in things that they used to find enjoyable or interesting. Of course, that's the exact opposite of what you need to do. But it is initially difficult to do a 180 and to make a call when you don't feel like it, to reach out for others when it isn't just emotionally feels natural to do that. So they're teaching people the acceptance and mindfulness methods, so you can watch these kind of depressive chatter that's going on without entanglement, without fighting it, without arguing back, but just noticing it. It's habitual, it's there. And to notice, for example, the feelings of lethargy or sadness, and what do you really want your life to be about? So you focus on the actions that are important to you and getting you involved in your life, getting going. And turns out that's probably the single most healthy thing that you can do. Behavioral activation, getting out and doing the things that are meaningful to you, probably the single best thing you can do in depression. A similar thing happens in anxiety. It's a little bit different, a little more emotion focused, but it's the same basic message of learning to feel those feelings and watch the thoughts will help shorten these kinds of episodes and will prevent their reoccurrence in the future.
So as I'm hearing you talk about that, what comes to my mind, it's like someone having their depression without their depression having them.
Exactly. So whose life is this anyway?
Yeah, so they have a chance to have a life, huh?
Exactly.
Yeah.
And there, sometimes people will actually say, I am depressed, or I am agoraphobic, and people can get into a role in which almost it becomes your identity.
Yeah.
And that's another thing you have to let go of, is the attachment to that thought. No, you've had some struggles, but you can, moment by moment, with your feet, with your actual behavior, create the kind of life that you want to create. And if you let your behavior be the engine and emotions and thoughts be the exhaust instead of the other way around, then you've got a lot more energy and ability to move forward. If you wait for the emotions and thoughts to pull you forward, you're going to wait a long time when you're struggling with depression or anxiety.
And of course, so many people that do have heart disease or chronic pain or diabetes, those physical illnesses, sometimes then there's a high rate of also having depression or anxiety.
Oh, yeah.
And so an ACT therapist is really dealing on the physical, mental, emotional, and existential level with this human being. Huh?
Part of what's exciting about what we're doing is we think we're on to a common core process that is there in so many things. And once you learn it, you do have to learn how to apply it to new things. There's some differences. And it's an odd trick of mind that even though you've applied it multiple times, it may not occur to you how to do this. Do we have time for me to give an example of my own life? I have tinnitus. I have ringing in my ears, and it occurred, I guess about 5 or 6 years ago. I'm an ACT therapist. I've worked on this for 25 years, and it was bothering me to the point where I'm just like waiting to take my head off. Like, when is this ringing going to stop? And it finally occurred to me. I mean, I literally went months and months before it even occurred to me to do the same thing that I've learned to teach others to do with so many other problems. And it very quickly resolved. Today this is the first time I've noticed ringing in my ears. There it is, because now I'm talking about it. But when you really are more accepting of it and just allow it to be there, you're no longer attending to it. And yes, it's there, but it's no longer as much a presence in my life.
Well, thanks for sharing that personal example of how this wonderful therapy can be helpful for people with physical illness and chronic illness. Up on the screen, there's some information. May is Mental Health Month. Hopefully you will join Dr. Carlos Brandenburg and NAMI and all the other folks out at Rock Park to address this really important social issue. We want to thank Dr. Hayes. Dr. Hayes, thank you so much for coming and sharing your wisdom with us. We hope to have Dr. Hayes back again. We want to ask you to join us next month, actually. Dr. Carlos Brandenburg will be our guest, and he will be talking about the state of mental health in the state of Nevada. And so we will see you back here in May with Dr. Brandenburg. And again, we want to thank Dr. Stephen Hayes for coming and sharing his wisdom with us. And if you get a minute, why don't you grab Dr. Hayes' book and take a good look at it. Thank you for joining us.